making sure our community's kids go safely back to school. Second semester's in session. Thousands more kids are going back to in-person learning. Are schools ready for it? This is the Rebound Tampa Bay podcast. I'm James Tully. My guest today is Hillsborough County Public School Superintendent Addison Davis. He says, yes, they are ready for it. As a matter of fact, he has just released their first plan to get some of his staff their first dose of the COVID-19 vaccine. We talk about that. We talk about what he's learned from the first semester, missteps, challenges along the way, how he's implementing new guidelines into this next semester, and making sure that kids get back on track or stay on track. Here's our full conversation. He is Addison Davis, Superintendent, Hillsborough County Public School District. What a first year for you on the job, Mr. Davis. I mean, talk about trial by fire. It's been kind of a challenging first year at the helm, huh?
It absolutely has, sir. You know what? First and foremost, thank you for having me. And
no problem.
It's been definitely an opportunity to learn, an opportunity to serve in Hillsborough County. We've been on the job for the first week, and you have to shut down 240, schools and be able to move 220,000 students from brick and mortar to e-learning. It has been really interesting and transitional, but we get an opportunity to learn new innovative strategies about how to really serve children if we're ever faced with any other type of pandemic in the future.
Yeah, for sure. And I want to talk about that and a whole lot more here in the short time that I have you. I think back, I remember taking you live probably at the end of March on Good Morning Tampa Bay when you announced the closure of an elementary school because there was a positive case. We've come pretty far since then. And what you're going to talk about today here, first up, is your vaccination plan, at least the very first phase of it for employees in the school district. Now, I'm going to assume you're following suit with what Pinellas County has already done. And for our viewers and listeners that are familiar with that, or the ones that aren't, go ahead and explain what you guys are going to try and implement here in the early going.
Yes, sir. And, we have been in cooperation and coordination for the last couple of weeks with TGH and also the Department of Health and other partners trying to figure out what we can do to really provide time and vaccines to those individuals who are in education and serving children every day who meet the tier 1 threshold and are 65 years or older. So this is inclusive of our teachers, support staff, district staff who are on the front lines every single day in our pandemic. They work tremendously hard. They've been superheroes every single day for our community. But I believe it's imperative that we provide them with such protection as soon as possible, as we can continue to mitigate COVID-19, especially those who continue to teach in a brick and mortar fashion with our organization. So through this partnership with TGH, we're going to provide access for all employees under our umbrella who are 65 years or older to be able to have access to the vaccine through TGH and also Department of Health, which will start on Friday, January the 22nd, and also on Saturday, January 23rd. And this will all be by appointments only, so we'll work that coordination out with our partners to further identify who's eligible and for them to be able to be a part of this vaccine, because it's really so important that we add another layer of protection. And we have around 1,200 employees that qualify for this criteria, meet this criteria, and just so happy that we have healthcare partners stepping up to truly help us in this process.
We talk about the Hillsborough County School District. I mean, you're not just the largest school district in our viewing area, you're one of the largest in the country. So we're talking, this is significant because up until this point, we have, of course, ad nauseum been talking for the last couple of days, really it's been a couple of weeks at this point, about just the staggered process in which the vaccine distributions rolled out in the Bay Area. And of course, the governor's priority were frontline healthcare workers first, and then, of course, Florida residents 65 and older. Now correct me if I'm wrong, you're giving a fast track for all of your employees 65 and older to go ahead and get the vaccine at distribution sites that you've already arranged with TGH and the Health Department of Florida. Is that correct?
This is correct. And in December, I, wrote and drafted a communication to send to Governor DeSantis, just advocating for teachers to be part of that priority for the vaccine, because they truly are, in the front lines, educating our children and keeping our community thriving every single day.
No one's going to disagree with that, but I'm just curious what kind of feedback you got from the governor or from his office or anything at all in response to your letter.
You know what? Didn't really have a response. Had many conversations with Department of Education, the chancellors, to be able to talk about the need and overall talk about what the plan may be. They've all been trying to advocate to make this happen, but I truly understand from the governor's perspective, trying to address everyone that are the most critical subjective to COVID-19 and trying to help them as well. And without a doubt, we say whether it's healthcare, whether it's mental health care, and whether it's those who are 65 years or older, I do believe it's a priority. But we also, when we're asking our schools to open, asking our schools and our teachers and our support staff and our leaders to connect with children and expose themselves to so many different students and families, that they really need to be on the consideration list and made a priority to further protect them as they take on a monumental task every single day within our community.
He's Superintendent, Hillsborough County Public Schools, Addison Davis, joining us on the Rebound Tampa Bay podcast. Can you shed any light, Addison, on what the next step might be down the pipeline here? We're talking 65 and older. Do you have another age bracket in mind as we move down through here? Anything you can tell us about what your thoughts are for the next step in this plan?
Right. And I think it just has to have a staircase approach to this, and we need to start looking at a subset of our next cohort of educators within our educational community, looking at those who are 65 years to let's just say potentially 64 to 40, to be able to see if we can have that next wave of exposure. But we've got to also make sure that we're in concert and coordination with our community, because one thing we don't want to do as a school district, we don't want to be able to carve out or take away from those who are 65 years or older in our community. We want them to be able to have that accessibility. But once again, we have to continue to advocate for our educators, especially me as the instructional leader, advocate for every one of our employees. We got 25,000 employees, so being able to gain access to every one of our teachers, our support staff in certain particular buckets, and eventually hoping to get to allow that to every one of our employees where they feel most comfortable. And this is just another step to mitigate. Now, we will continue all of our procedures and policies in our reopening plan to further protect our classrooms. But I think it just signals that we continue to care and for our employees within Hillsborough County.
Interesting to me. That's the first time we've kind of heard what that next age bracket might be. If you go down to 40 or 50 years old or whatever it is. But you said 64 to 40 might be something to shoot for in the next stage. That's interesting. It's the first time I've really heard that.
Yeah, I mean it's for us it's a big bucket, and then from there we'll transition for potentially 40 and under. And I think that gives us a three-tiered approach to be able to serve our employees in the organization. And once again, in no way, shape, or form will this ever be mandated from our perspective, but we just want to be able to extend this as an offering so that there's a system of care within our organization and show and validate the hard work that they're doing every single day.
So glad you brought up the word mandate. And obviously, that's going to bring up my next set of questions here. But in all seriousness, I mean, we just had an interview on the podcast here with a lawyer who deals with all kinds of employee-employer situations. And we're talking about mandating the vaccine and what have you. Safe to say, you do have vaccines in the district, Addison, that are mandated, correct?
Absolutely. We do for our students. We have a number of vaccines that we require, which are outlined by the Florida Department of Education, that it was coordinated with the Department of Health, that we have to get with our students through all grade bands and grade levels and thresholds they have to hit. So we do make certain that those shots are kept up on records, and we can continue to communicate with our stakeholders to make sure that's a reality, so that our kids can continue to come to school and play interactive roles every day.
Of course, we're in a weird situation with this vaccine because it's under an emergency use authorization. So mandating it in the same way that those other vaccines are mandated, you don't see that as an option. And I think that's the way that a lot of school districts are going to follow suit here down the line.
Yeah, I mean, right now we don't see that as a mandate, not from Hillsborough County, and particularly I don't believe it to be a mandate anytime soon throughout the state of Florida. I think right now it's more of a voluntary basis, because I think there's potential concerns of the overall reactions to the vaccine, the overall efficiency to the vaccine. So we want while we want to encourage vaccines to be able to take place And it's all about, continue to educate our employees about the overall potential impact that it could have, and versus forcing them to make a decision that's against their will. So right now, no mandate at all, just be solely based on the recommendation from our recommendation of the employee to actively engage through it.
And we're a long way from even having this vaccine be available to kids, and trials are incomplete and things like that. So when you talk about the 18 and under age group, all your students, we might be a really long way before they even have the opportunity to be vaccinated. I know you can't wait for the day that you can relax things like mask mandates and social distancing. As a news anchor in this country of ours, I can't wait for the day until I relax those terms and never have to say them again.
That's right. That's right. I mean, it's absolutely, I will say this is that while the vaccine is going to be available to certain tiers within our community, eventually we'll get to a part where, these vaccines are going to potentially be approved for emergency use for individuals that are 18 years or older and potentially younger. We have scientists that are continuing to look at all the effects on our youth and also on those who are within our community at multiple age levels. But as it relates to us, what we're going to continue to do is follow CDC guidelines. And while the vaccine may be provided to our educators, we're still going to require masks. We're still going to be involved in controlled movements. We're still going to engage in proper hygiene and also provide surface wipes and hand sanitizers and hand sanitation stations in our classrooms, and have protocols to further protect and mitigate COVID-19. So, but we're waiting for a day eventually that we get to a part where we can get back to some kind of normalcy. And we hope this vaccine will play an instrumental part of it.
An important week for all of us there, as we at Good Morning Tampa Bay, ABC Action News, we have our Safely Back to School week. We're trying to inform all the parents out there of what they need to know. And you are bringing a lot more kids back to in-person learning. The first semester, I've talked to teachers, is a challenge, especially when you have teachers that have the Zoom calls up there and you have the kids in the classroom. You have some kids at home that aren't turning on their cameras, and they have to learn both ways. You had ACT tests, SAT testing suspended. What a wild first semester you had. Moving forward into this next semester, tell me, what have you learned? What are you going to try and do differently?
One thing we've learned is that we have to be flexible. Every single minute, every single day with this pandemic, we learn something new about how we can evolve and get better. Whether it's continuing to make certain that we have modified pathways of our students to interact and walk through hallways, whether it's continue to look at how we modify our classrooms to remove any insignificant furniture or items out of the classroom so that we can try our best to social distance. And let me be very clear. I said it in the summer, social distancing is cannot be done to the full effect in education. It's just so hard to do. We're not built that way, whether it's on a bus, whether it's in a classroom. We're trying our best to be able to do that. We have 14,000 new students that are coming back to us that started on yesterday. So being able to make those accommodations as well. And I think for us, it's all about what we did really well is really making certain that we educated our children how to take the proper hygiene and initiative to care for themselves. And our children, when we said that, 5, 6, 7, 8-year-olds will not wear masks all day, they did a beautiful job in doing that and really making certain that they say actively following our procedures. And we've done a really nice job making certain that we have the necessary signage about how we flow through our schools and how we interact. And as you said, the first semester has been such a learning curve about how we are dealing with brick and mortars students, how we're dealing with remote learning students, K-12 virtual students, simultaneous teaching, you name it. It's been so complex, but at the same time, it's been an opportunity for us to learn and grow and really identify where gaps may lie, whether that's instructional gaps, whether that's mental health gaps, whether that's nutritional gaps, and to be able to further serve. So I think for us is just, for the second semester, we've got to focus more on the well-being of our students, the well-being of our employees, because it's been a long first semester. And the second semester for us, it's all about how we can help them feel better in the educational environment, related to be able to compete socially, emotionally, and intellectually every day.
Now, how do you feel about the quality of learning, though, given what took a hit there in the first semester and moving forward? Where does your confidence level lie there in maybe how it was and how it can be here as your mitigation processes continue and the vaccination distributions start up?
Every day we're trying to redefine, reimagine, and strengthen our instructional work and in our instructional delivery to our children. How, being able to maximize our curriculum, maximize moments of learning. How does our instructional frameworks look like? What do we do to differentiate instruction? Because it's very hard to do small group work. How are we going to scaffold instruction? All of those are part of the conversation, the culture we're trying to transform in Hillsborough County. It's been very difficult to do because when we have a number of students that are engaged in the remote learning in the first semester, being able to make certain they're actively engaged every single day and following a rigorous schedule has been sometimes complex. So how are we leveraging school staff, district staff, social worker to make those connections with our students so they can be successful? And at the same time, as we get to a part where we're embracing 14,000 students. We know the majority of our students are going to learn best from face-to-face instruction. We know the majority of our teachers who have been trained to teach face-to-face are going to have more,
do a
better job, face-to-face. So, we've had our technological, issues, learning platform issues, but, we're going to be in a better spot at this stage in the second semester than the first semester. My concern is this, and parents need to know that the state's been very clear. They're asking our students to participate in state mandated assessments. And for a year where we've had so much to learn, with so much to deal with the pandemic, I openly believe while an assessment may tell us how to identify whether or not learning gaps still exist, whether or not we need to how we build our master schedules, what courses we need to identify for our students. With school assessments come school grades and district grades. And in a pandemic, no one cares about a school grade or a district grade. And so for me, it's more about the well-being of our community, the well-being of our children. But at the same time, hoping that we can connect with every one of our learners to be able to address any intellectual gaps that may have been created to being able to be out of school since March of 2020. And, because our students were out from March 2020. And while we did some innovative solutions, we didn't get them back to August. And sometimes, and I went to schools the last 2 days, on the back of the second semester, and I'm seeing new faces across this district that haven't been in brick and mortar all year. So we've got to figure out what gaps may exist to be able to triage and hope and work to get them to a point where they're meeting grade level expectations.
I mean, it might be too much inside baseball, but I have to ask you, is that a revamp of curriculum? I mean, it's a case-by-case basis with thousands of kids. I mean, how do you even go about trying to do that, to figure out who's behind, who's not behind, and what has to be revamped in a certain class or whatever else? I mean, that just seems like a monumental task.
It definitely is. The biggest thing is for our parents to know that we'll be doing some mid-year assessments to be able to look at how well our students did from the beginning of the year, from baseline assessments at the beginning of the year to how well our students have competed at the mid-year point. And from that will allow us to tailor instruction, to be able to look at annually assessed standards and that students have not met the threshold with, for us to really determine what supplemental resources are needed to be able to provide interventions to our children, whether that's before, during, or after school. It's our role to help children succeed and excel. And, hats off to our teachers and leaders who continue to do monumental work with this.
Certainly great information there. Addison Davis, Superintendent, Hillsborough County Schools, joining me here on the Rebound Tampa Bay podcast. And we'll end with this. The case numbers we've seen kind of level off a little bit, but in the early part of this month in January here, they were really high. Recently, I think in your district, you had case numbers in the triple digits, over 100 cases. We know a whole lot more about this virus now, and I can only imagine as a superintendent, you feel really powerless in these situations when positive cases pop up, because that's just it. That it's going to happen. We understand how quickly the virus spreads. We also understand that cases don't equal death, and cases don't always equal sickness either. How do you take that? What is your reaction to it when you see a high number of cases in a certain day? Are you trustworthy of your quarantine process? Do you have like a moment where you take a step back and think, okay, this is really high, I need to assess it differently? I mean, what goes through your mind in your position when case numbers rise and you know the steps that have to be taken all throughout the district to control it?
First and foremost, my hat goes off to our COVID commander, our teams, and our leaders at our schools and the district level, and also our rapid response teams who are working through every night of the hour to be able to deep clean our schools and make certain they're prepared for the next day for our learners and for our employees. We focus on, I get an alert and update every time that we have positive cases within our schools in our district, and so that we can look at trends and patterns and determine if there's a systemic issue or a potential outbreak at a particular grade level or a wing of a school that we need to be able to address. And when we see that particular numbers may be increasing in particular areas or a subset of communities, what we are in schools, we have a beautiful partnership with TGH and USF Health who are at the table with us to be able to walk a school, determine whether or not are our schools a part where it's a super spreader issue, or is it particularly related to the community? Or if we can do something differently at the school to refine our practices in order to mitigate COVID. And the things that we found out through our partnerships with the Department of Health and TGH and USF Health is that the issue isn't in our schools, it's in the community. While everyone is exhausted with this pandemic, more importantly, we got to continue to make certain that we are social distancing, we're wearing our masks, we're not involved in major gatherings. And I know it's hard to do coming off the holiday break and then having extended weekends, and but we just got to continue to do this together and not be mentally exhausted with this pandemic. From our side of it, we triage and watch every one of our schools to look at the percentage of students that are quarantined and employees that are quarantined to make certain that we can continue to provide open door brick and mortar solutions. And so it's on our mind. For us, it's always in the forefront to determine whether or not we open a wing, close a wing, open a classroom, close a wing, close a classroom or a grade level or a school, because we've got to really make sound decisions that protect our students and also the working conditions of our adults.
And you're confident in your ability to do it. Hey, I got to ask you, can you give yourself a letter grade for how you've done with that?
Put it this way, we've done a really nice job, and we can always improve. I give my team an A for effort. Let's put it that way.
Sure.
And we continue to work with the Department of Health who does our contact tracing with us. But we can always get better. So, when we look at that continuous improvement model, I'd say that I'm happy with the performance as of right now. But can we improve? The answer to that is yes.
All right, and please apologize the hackiness of that question. I'm just trying to crack
a smile. Yeah, it's okay.
We're all exhausted, and we're all waiting to see some more light at the end of the tunnel. Addison Davis joined me on the Rebound Tampa Bay podcast. I'm going to end like this. I'm going to give you the floor. You have a lot of parents who are going to listen to this. They're going to watch it. The same ones that watch Good Morning Tampa Bay and wait for all the news on the district and mandates that come down. The floor is yours, sir. Anything you want parents to know first and foremost right now where things stand here in the middle of January?
You know what? First and foremost, my hat's off to all of our parents, our community members. We thank them so very much for this year that's been so unprecedented. We know that you may have had children that have been in and out of school during the quarantines or during are tested positive with this process. And the only thing I ask is just continue to be a partner with us, continue to connect with our teachers, connect with our school-based leaders, and let's be able to collectively acknowledge our celebrations, but at the same time, provide feedback about how we can strengthen our processes. One thing we did do is we knew that in the quarantine process that we had some inconsistencies of delivery of instruction, and to no one's fault of their own. Everyone's doing the best job that we can do, because you got a reminder, 90% of our teachers signed up to teach in a brick and mortar fashion to a face-to-face. So we will be launching a quarantine help center that's going to be from K to 12 in the next couple of days, that allows our parents to go in and look and identify instructional practices and work that allow them to strengthen their child while they're at home through a quarantine process. It gives a number of opportunities and connection for internal and external services they may need with their families as well. And just know that we're here. And we thank them, we thank all of our teachers, we thank all of our support staff and our leaders. We also thank every one of our medical leads and mental health leads for continuing to be there. But if our parents in our community need us in any type of way, let us know. We're all about developing not only the whole child, but the whole family. And we look forward to continue to create the best experiences we can for every learner during these trying times. There's light at the end of the tunnel. We'll get there together, and then we'll continue to strengthen our practices every day. So we're thankful for our parents for their trust in us, and we'll continue to create the greatest experience we can for every student.
And to bring things full circle to start where we began, the announcement you've just made, I guess today, as we record this podcast, is that you're beginning a process partnering with TGH and the health department in our state of Florida to start vaccinating all your employees 65 and older, not just teachers. You said all staff 65 and older. You're going to work out something there. Just a goal on a timeline there as for when you want to, everybody who is eligible, to get them at least with their first dose?
Yeah, we're just trying to get that. That'll be done on the Friday, January the 22nd, and Saturday the 23rd. So we're trying to get every one of them. Hopefully, will engage in this practice and get it done. We'll see the overall participation rate, and if there's a need for us to reopen it again, we'll work with our partners with TGH and the Department of Health to do so. But let's, fingers crossed, we'll create this wave and be able to have accessibility for the availability for majority of our employees under our umbrella.
Hey, look, and kudos to you for circumventing, and you and the superintendents at the other school districts who seem to be circumventing the system, at least in getting them in there and doing it, because the thing that's had me shaking my head a little bit here with this whole process is, and I understand the most efficient way to do appointments for vaccines, of course, is online and through portals and everything else. It's hard for our older citizens sometimes to really, digest all of that. And I know because I have parents that are a little bit older, and just the idea of getting them online and to go through the certain steps and everything else, it's frustrating for them, I know. It might be the most efficient way to do it in the year 2021 here, but it is frustrating, no question.
Right.
So.
Yeah, I mean, I see the frustration openly, and I wish that the vaccine was available in truckloads, and I think our community would feel awesome about that. We locally allow our local leaders to do it in a sophisticated, comprehensive manner. I mean, from our side, that we're asking our schools to be open every single day and subject themselves to so many different to learners, and I just think it's important for people should know now more than ever what the school district brings to the fluency of our community. When we close, a lot of things stop because of childcare, the interaction. When we're open, we're able to thrive as a community. So, we're thankful for the availability through our partnership to have this vaccine, and it's just another step to help and validate that we care.
And this, again, coming from somebody who just a few years ago had to teach his grandfather how to double-click a mouse. So, there are some generational differences when it comes to technology. Okay, look, again, I have to give you a lot of credit. You're dealing with an unprecedented situation, a once in 100 year situation. Your first year on the job, Addison Davis, but you're still standing and you're tying your tie on straight. So that's a good thing.
Yes, sir. Thank you. I tell you what, I should have read the fine print, coming in, but I tell you, I've learned to love this community. This is one of the first communities, and this is my third educational system that I've been in, where the civic leaders, their delegation, family members, community members, educators, all want the same thing, and that's a quality education system. They're all working in concert to do so. So I'm blown away about the ongoing support of education, and I look forward to doing some special, magical things for our children.
The Rebound Tampa Bay podcast is brought to you ad-free right here on the ABC Action News mobile app and on your favorite podcast provider like Spotify, Stitcher, and Apple, just to name a few. I also put video versions up on my Facebook page and on the ABC Action News mobile app and streaming news service. As always, thanks for listening. We'll be back again next week with a brand new episode.